What's up, everybody? Happy Thursday. Today, we're talking about whether or not you can lift weights if you just got a cortisone injection or gel shot, and more specifically, if the Get Rid of Your Knee Pain program is a good fit for you if you've just gotten a cortisone injection or a gel shot. So, the answer is yes, absolutely. You can lift weights after getting a cortisone injection or a gel shot, and you can absolutely benefit from this program if you fall into that category as well. In fact, it's actually recommended that you actually lift weights, exercise after getting these treatments because they are not a substitute for exercise and they are not a long term solution. So let's get started with cortisone injections. So cortisone injections are typically used to treat knee conditions like osteoarthritis, meniscus tears, tendonitis, right? So here's how they work. Because cortisone injections are a powerful anti-inflammatory medication, it can obviously help to decrease inflammation in your knee, which can provide pain, and that can help you feel better, have pain relief, and also decrease swelling. So, with that being said, if you have pain relief, you can tolerate movement and activities that you were initially having pain with a lot better. So, with that being said, because you have a cortisone injection and it doesn't actually cure the underlying problem, you're going to want to use that time that you're experiencing any relief to take advantage of exercise and start to improve the muscles around your knee because now you're not experiencing as much pain. So, although cortisone injections do not completely solve your knee pain, they can put you in a position to tolerate exercises that you may not have been able to do before. But with that being said, that's why it's so important that you continue to exercise because if it's not curing the actual problem, it's likely to come back. This is why people have relief with cortisone injections for either a few weeks or a few months, and then the pain comes back and they end up being in this cycle. And cortisone injections are not good for your ligaments and are not good for your tendon health. They actually weaken them, which is why you cannot get them until a certain period of time has passed. They're not good for your body. So you don't want to become reliant on these things. You want to use it in order to put you in a position to actually tolerate painful things that were once painful, and then get better from there. So yes, you can lift weights with the cortisone injection. It is actually recommended that you do that so that you can have long-term pain relief and not just mask the symptoms. When it comes to gel shots work a little bit differently than cortisone injections. If you have gotten gel shots, cortisone injections before, you may be recommended a gel shot because they're not really detrimental to your body as a cortisone injection is. But the way gel shots work, and they're also known as viscosupplementation, you may know those two words. This is not a substitute for exercise either, nor is it a magic fix for knee pain. So the way this works is the gel shot mimics the natural lubrication that your knee joint naturally has, right? And that natural lubrication helps your knee to move smoothly over each other and absorb shock. So you have your knee joint, right? And you have cartilage that lines the ends of your bones. And when you move those, the cartilage kind of rubs across each other, but you have lubrication there to make it move smoothly, right? But if you have osteoarthritis or if you have a meniscus tear, that natural smooth movement can be inhibited. And also, the natural lubricant that your body creates is also reduced. So that's going to cause the joint to lose that cushioning and lose that smooth movement. So the gel injection is inserted into your knee joint to mimic that same lubrication, and that's going to help to ease the pain and improve your motion. But sometimes these things do not work. Sometimes people do have temporary pain relief with it, and other times they do not. But this is another situation where if you get it and you do have pain relief, you can actually benefit from exercising and be able to tolerate a lot more than you would have without it. But the caveat is you cannot just go about your life and continue on as normal and be like, oh, my knee feels better, I don't have to do anything. You have to address it while you have the chance, or you'll end up in the cycle of pain over and over and over. You'll be one of those people that are reliant on cortisone injections, and they always say they have bad knees and they can't do this and can't do that. And the reality is they just need to find ways to strengthen the muscles around their joint to provide support to the joint, because these treatments that they're often recommending are not long-term solutions. They're just ways to help you get into a rhythm with exercise, because they can improve your pain temporarily, but it's not a long-term solution. So if you are looking to um, improve your pain for the long run and you just got a cortisone injection, you need to take advantage of this early bird special. The Get Rid of Your Knee Pain program is only $97 until November 23rd. So definitely take advantage of this time when your body is probably in less pain because of the cortisone injection you got or the gel injection you got. And let's get you going with a lower body rehab training program. Get your knees stronger, get some protection for your knees as you get older, and let's be great. So, with that being said, if you guys have any questions regarding knee pain or specifically to get rid of your knee pain program, drop them in the comments or message me below. And I'll catch you guys later. Peace.